Good morning, everyone.
Hey, everyone. I didn't even know we were on, Chrissy. You usually warn me.
That thing's in the way.
Uh-oh.
That's all right.
Anyway, happy Easter, everyone. Enjoy this beautiful day. We're going to finish up today. We're going to talk about hypertension. We talked about pre-hypertension the other day, and a lot of it is the same information. But hypertension is really, your blood pressure is determined by the amount of blood that your heart pumps and the amount of resistance to the blood flow in the arteries. The more blood your heart pumps and the narrower the arteries, the higher your blood pressure. High blood pressure generally develops over many years. It affects nearly everyone eventually. Fortunately, it's easily detected, and you can work with your healthcare provider to be able to work with it. What are the symptoms of high blood pressure? That's the problem. There really aren't any symptoms. Very few people will have symptoms of nosebleeds or headaches or shortness of breath, but that doesn't usually occur until many years and until it's severely high. There's two different types of high blood pressure. One is primary or essential hypertension, and really what that means is there's no identifiable cause. It generally takes years before that occurs. Secondary causes of hypertension means that something else is causing it, like thyroid disease, kidney problems, adrenal tumors, obstructive sleep apnea. Certain medications will cause it, like birth control pills, NSAIDs that I've talked to you all about, how I just can't stand that class of medications that causes kidney disease and damage and certainly can cause high blood pressure. Other things like decongestants, illegal drugs, alcohol abuse. There are certain factors that put you at risk for hypertension: age, race, family history, being overweight or obese, not being physically active, any use of any type of tobacco products, and even, like we talked about the other day, secondhand tobacco exposure will cause you to have hypertension. Too much salt in your diet, too low of potassium in your diet, and now they're identifying probably too low of a vitamin D can cause hypertension. Drinking too much alcohol, stress, and who doesn't have that, and other health conditions like kidney disease and things like that. Diabetes certainly can cause high blood pressure. What are the complications that happen with high blood pressure? It actually, with all of that pressure inside those arteries, it causes damage to your blood vessels and thus then organs in your body. The higher your blood pressure and the longer it goes undiagnosed or untreated, usually the more damage you're going to have. The complications are heart attack or stroke, an aneurysm, heart failure, kidney disease causing renal failure, or narrowed blood vessels in the eyes can result in vision loss. Uncontrolled hypertension may also affect your ability to think, remember, and learn. There are 4 categories of blood pressure. One is normotensive or normal blood pressure, pre-hypertensive that we talked about, and stage 1 hypertension, stage 2 hypertension. Chrissy put up a nice chart the other day. I believe it has the numbers for all of that, and I'll certainly be glad to answer any questions about those. Just know that when it becomes stage 2, that's pretty extensive blood pressure. Things that you can do about it, the modifiable things. Again, eating a healthier diet. The other day we talked about the DASH diet, excellent for hypertension. Exercise regularly, quitting smoking, limiting the amount of alcohol that you drink. For a woman, 1 a day. For men, it's 2 a day. Anything beyond that is excessive and can cause you to have hypertension, as well as other things. Maintaining a healthy weight loss program will also help you. So you need to, if you have any obesity or being overweight, you need to address that. We have now over a dozen categories of medications that help with hypertension. And in family practice, in our practice, what we tend to generally use is 5 out of them: thiazide diuretics, beta blockers, ACE inhibitors, ARBs, calcium channel blockers. And again, there's many others. But that, along with dietary and lifestyle modifications, is really the thing that works the best. It's not one or the other, it happens to be both. Talk to your healthcare provider about what's the best option for you. All right, Chrissy, tell us what you have for us.
I'm smiling because everybody loves our bunny ears.
Oh, they do?
Yeah.
That was totally a Chrissy thing.
Happy Easter! All right, so we're going to announce our new contest today. And like we've been saying, it's a very fun one. Let me just get this together here.
Here's the story. A lovely lady who was
All
bringing
right.
up three very lovely girls.
We had a lot of
All of them
fun.
had hair of gold, like their mother.
Everybody, we all have our own Bitmoji.
It's a story of a man named Brady who was busy with three boys.
All right, so what the contest is you have to figure out whose Bitmoji belongs to who. I'm going to post a picture of this so you don't have to keep coming back to this video, and we'll also have it in the waiting room in the office, and I'll include a list of everybody's names too so that you can try to figure it out. This also includes our surprise that we have for the end of the month. You'll be able to figure it out after you figure out everybody on that list. You'll be able to figure out our surprise for the end of the month that we're gonna bring out to you on April 28th. And then after this month, we're gonna switch up the gears on what we do for each medical minute. Next month, we're gonna go towards more of a dialogue based, where it's more of a fun, just a talk show between me and Joan, and then Susie and Joan, and hopefully the other girls will want to come do it with us, because it can't just be us. You guys might get sick of us.
Yeah.
So again, please send us your ideas. We'd love this to just be like a talking. We'd love more people to pop on and send us questions, and we could answer them live. We would love to do that for you too. Oh yeah, and the prize for this contest is a $60 gift card to Sabatino's, because it's a difficult one, so you deserve to be rewarded well. So I'll post that after this, and it'll be in the lobby. And yeah, that's it. Good luck.
Good luck and happy Easter, everyone. Enjoy your weekend.
Bye. Happy Easter.
We'll see you soon.